If you want to see what viewers camera.
Welcome, everyone. We are being joined by friends and supporters of Village Health Works across the globe. It is still in the morning somewhere, it's an afternoon somewhere else, and it's an evening right here in Burundi where I am with our colleagues and friends. Wherever you are, thank you so very much for joining this conversation that we're about to start. It's a conversation about Village Health Works. It is hard really for me to believe that it's almost 20 years since when we started, from laying the foundation of this organization to saving lives and educating our students in such a beautiful, dignified campus. With only local communities, we certainly wouldn't be here where we are today without the kindness and generosity of some friends, and there are so many by thousands, who have rolled their sleeves up and joined a dream to make it a reality. Words are not really enough to express my gratitude. Thank you so much from the bottom of my heart for being with us and buying in the mission of this organization. It's amazing what has been happening. I know not everyone can be in Burundi, but those who have been here can share with you what has been going on. Is truly hard to put into words, and it is beautiful. Tonight, you will hear from three of the many wonderful doctors leading this work on the ground about the lives being saved, the challenges we face, and the opportunities to do more and better. To my left, there is Dr. Joelle. Joelle, hello.
No.
And to my right, there is Dr. Nesar, a medical director, and there is Dr. Cecilia, our OBGYN, and someone who is in charge of our maternity ward. Let me start with you, Joelle, next to me here. You have been at Village Health Works for how many years now?
6.
6. That is wonderful. And you are co-leading the very busy outpatient department, and I know you are one of many thousands of people who could not have waited for the opening of this new hospital. Before that, I know how many times you pulled your hair and wondering what's next, and me worried that tomorrow, if I come back, I may not find you here. In your role, could you please share with us how your life has changed professionally since you opened this new hospital for patients? Also, I know you have such a passion in nutrition, and I would love to know how we started. Thank you.
Thank you. I don't know where to begin. I think many things that have changed since the hospital opened. I think myself and other who have been here before the opening of the hospital, we used to be very stressed. But now our stress level has decreased because now we have a specialized care. Because if I start maybe by giving an example, like before, because we didn't have we didn't have a gynecologist, so now we have to transfer cases, and now because we are up in the mountains and the means of transportation are very difficult. So sometimes the women would come late, even if we had told them to come earlier. So now transferring a patient to Rumonge, it's like almost 45 minutes. So now we'll be here stressed back. Would she reach in time? Wouldn't she have problems on the way before they arrive there? But now we have specialized care. Now we don't have to stress about that because we just need to just call someone and now they are going to be taken care of without having the healthcare worker force in stress. The one who's transferring, the nurses who are transferring, or the ones who are staying here, we used to be really very stressed and be calling like, "How are you guys? How is it going?" So now the stress have decreased. It's not only about maternal care and child care. Also, we can also talk about like internal medicine. Having patients who don't have food and they are diabetic, and now they have to be given insulin. It's like, how would they get food if and they're not being? They don't. They are telling you they don't have food. Now it's like now it was challenging. Like we didn't know what to do, but now with the opening of the hospital, the patients are being fed. So that's also another stress that is decreased from the side of the healthcare providers. Now we don't have to stress and asking like, where is your relatives? Please, can you find something to eat for the patient? So that we don't have to stress about that. We can now focus on what is more important, the health of the patient. Yes, the food is also important, but now it's like what we are supposed to do now, it's like we are being pulled in different direction. Now we are thinking of the food, we are thinking of the vital signs of the patient, we are thinking of how do we proceed with the patient. But now it's like now we can focus on one thing because the other thing we don't need to pay much attention on it. We know every patient now will be given breakfast, we have lunch, they will have their dinner.
That's wonderful.
Yeah. So it's something that was really a good addition that helps us rest, less stress, because it's also healthcare workers need to have less level of stress.
Right, right.
Yeah, because without the specialized care, I would feel like sometimes I'd be like, I'm useless. It's like,
You are not useless.
Yeah.
You've done so much. And I know this from some patients and some of your colleagues who really have so much admiration for you.
So I know it's like I wasn't being, I knew for real I'm not useless, but it's like being a case where you are like, I would have preferred to do better, but I can't. But now when we have Nesar here or other specialists there that are helping, even the numbers of transfer have very decreased.
Yes.
It's less, very few. I think Nesar even came before we moved to the hospital. He used to see how many transfers we were doing.
Yes,
But now with the opening of the hospital, they are very few.
Yes.
And also even the drivers now, they don't have to work during the night.
That's wonderful.
Yeah, when they also have to go get the stuff from Monge.
Yes,
So
yes.
that was good. Also the training.
Yeah.
So now we get to be trained. So it's good every time when you have someone who knows better than you, who knows more. So because you get to learn. In the past 2 years, I've learned very many things, because now before we just have like specialists who are coming for a short time, but now you have them constantly there. So you are having continuous training. Not only planned training, also based on cases. So now we get to learn more, even in our consultation as general practitioners, we get to give more better care to our patients because you are learning more. Yes.
Yeah, thank you. Thank you so much. Speaking of Dr. Nesar, let me go to you. Dr. Nesar, it's good to have you here.
Thank you very much.
I will never forget the day I saw your CV, your application to join Village Health Works. You actually were not even thinking about the role of medical director. You said to me, I just needed to save lives and to be with patients. Then when I looked at your CV, I said to myself, my goodness, is this person really aware of where he's thinking to be? I saw a lot of publications in many well-known international journals. I saw a lot of your achievements in the past 30 years in your country, Afghanistan. at the big 600-bed teaching hospital at a university. And here you are from a big city, from a big university, a big teaching hospital, the chair of infectious disease, working with NATO, working with a lot of complicated cases and a lot of very sophisticated people, and you are here. Some of the people, one of the people who interviewed me were just wondering, like me, is he really going to come? Said you were too qualified to come here. I actually got a little struck by that. How can you be too qualified as a physician to be in a place where so many people have suffered needlessly? So I'd love to hear from you what has been your experience here at Village of Works since the past 2 years. What have you seen compared to the resources you had in Afghanistan, the colleagues you worked with? What has been your life here?
Thank you very much for this question. To ask this question, let me to describe my background and my journey from Afghanistan to Burundi here in Kigutu. As you mentioned, I was working at a 600-bed teaching hospital, university hospital in my country, which was a big referral hospital. And I held several leadership roles in my hospital, like head of infectious diseases department, head of research department, and lastly, scientific deputy of the hospital. And in 2021, when Taliban took over Afghanistan, I was forced to leave the country with my family. And we relocated in Rwanda, where I obtained my medical license from Rwandan Medical Council and started medical practice again in Rwanda until I found that the Village Health Works needs a doctor as a medical director in a hospital in a rural area. Then I applied to this position. And after several interviews, I was appointed as a medical director in this institution. A year of border and come to Burundi, I was thinking, and as a medical director, what challenges I might face in this remote and rural area in Burundi, and what we should do to overcome to these challenges, and to provide quality of care to patients and to the people that who deserve compassion and high quality care. And just I was thinking that finally I reached to Kigutu. And I remember when I visited the hospital, I amazed. I found a very beautiful design, well equipped, and a modern hospital in such a rural area in Burundi. And I was full of hope when I saw this hospital. And just I realized that it was not possible without a very strong commitment and strong leadership of the CEO and other leaders of this institution. And I remember when I joined the team here in Kigutu, the hospital was officially open, but still we hospitalized inpatients in the OPD clinic. And I found that we have a very committed team and very dedicated team, national Burundian doctors and nurses, that they are have willingness to learn a lot from the specialists. And then we started to recruit more specialists, emergency medicine physicians, general surgeons, research surgeons, anesthesiologists, anesthetists, gynecologists, internal medicine physician, pediatrician, family medicine physician. And after a while, after 2 months, we had a very strong team of specialists in the ground. And finally, we transferred patients from the OPD clinic to the hospital and started operations in the hospital. And from the beginning, we started to conduct specific trainings to the national staff. And also we started to establish hospital committees and work on treatment protocols and other documents like standard operating procedures. And since these 2 years, I see a transformative change in our doctors' skills, our national staff skills, nurses, midwives, general practitioners. And Dr. Cecilia is here and can confirm me that we have general practitioners that they are doing C-sections and other surgical surgeries independently. And also, most of our doctors and nurses, they gain more experiences and also new knowledge. And we have many continuing medical education programs, for example, bedside teaching, weekly conferences, protocol treatment trainings, and other specific trainings, BLS training, neonatology trainings, and many other trainings. And now, when I'm here, I see many similarities between the Afghan people and the Burundian people. With high prevalent malnutrition in both countries, high burden of infectious diseases and non-infectious here in Burundi and also in Afghanistan, and a lack of health facilities in rural areas in both countries, and also disparity, food insecurity, lack of clean water for the people. There are many similarities. Now I'm thinking I am in Afghanistan within Afghan people. And now Africa is my home, and Rwanda and Burundi are my second homes, like Afghanistan. And I'm very optimistic for this organization, also for this hospital. And it will be a very big hub for the training, for the healthcare in the country and also in region. And this is our region, our vision to transform this hospital as a center of excellence for the region and also for the.
Okay. Thank you. Thank you.
You're welcome.
Very much. You know, let me go to Dr. Cecilia, but I don't want to forget, I will come back to you about, just say something that reminds me of so many people who have told me how skeptical they are in terms of building a hospital like this one. But we'll talk about this later, but let me get, so, excuse me, to you, Cecilia. So, Cecilia, you are an OBGYN from Tanzania. Where were you working again?
I was working in
The networks?
Arusha, NSK Hospital.
In Arusha. Yes. Very different from these, or same location or similar? Same.
It's different. condition.
I would like to let you know, maybe you have heard that most likely you have performed hundreds of C-sections here in our hospital. I know that. But what I want to tell you more than that, because we know that's what you do in addition to many other things, taking care of mothers who are sick and so on and so forth. One of your colleagues, our colleagues, told me that we are not just helping mothers who are pregnant. You are spending so much time training local Burundians, general practitioners, nurses, and others. And one of them said that she could not imagine anyone who is as good as you are in training. I just want to thank you very much for what you do, because this hospital has been built not just to care for patients who need it the most, provide high quality health care, but also teaching. That's how you can replicate one of many best ways of replicating our model by training people, not just those who are here, but who are also coming from other parts of the country. Please, can you share with us what your experience has been in patient care? I know there are so many challenges. I have heard a lot of stories. If you could share with us your journey from Tanzania to Burundi. I think you are one of the people who said, my goodness, after passing Rumonge, where am I going? And then you got here and you said, what happened? So please share with us and our friends who are listening to us.
Thank you, Deo, and everyone who are listening on us. So with my experience, I've been working previously, I was in town, actually in urban. So the condition, actually the environment is quite different. And since I came here, I've gone through other of the obstetric condition which I had never seen. I can give an example. I had never seen a mother who has been operated already 6 times, and she comes in labor. Actually, I've never even heard about that once I was back home in Tanzania, but I've observed all these cases from 5 previous scars, 6 previous cesarean sections, and all those, they come in labor without any appointment for elective cesarean section. And we managed to operate them successfully without any complication, both to the mother and to the baby. So since I came, my experience for sure, it has been rewarding. Professionally, have grown. I've quite helped my nurses and my midwives, as initially they were all transferring the mothers to the nearby health facilities such as Rumonge and Bururi. They are not able to manage all the high-risk pregnancies. So they are all managing only the normal labor. So once it complicates, they need to refer. But since I came, I started from the ground. I had to create some protocols. This is a standard operating procedure, so that I know once we have reached on this, maybe it's a prolong, we need to augment. As initially, they are not even augmenting a labor, as sometimes the augmentation may fail and the patient may need to go for cesarean. So we started from scratch to start with, be able to augment labors, to be able to do induction so that we reduce the transfer. So once all those fails, we go for cesarean section. Apart from that, I've managed to train also my GPs, those who are rotating my department, at least start doing, to be able to do manual vacuum aspiration, especially for the abortion, which we have a lot of those cases. And we know unsafe abortion is among the one causes of the maternal mortality, among the 5 direct causes of maternal mortality. But currently we can do all the cases of miscarriages safely without any complications. So apart from the GP, even the midwives, they're now able to perform all those cases, even if at night when the mother comes with a bleeding due because of the remain products of conception inside the uterus, they have experienced midwives who can perform the manual vacuum aspiration. So with this experience, being able to do delivery since I came in March until now of more than 1,300, that include both cesarean section and normal deliveries. Yeah, unfortunately, we got only 3 maternal deaths, although they were not directly related. One was just a referral from another health facility who came here in a late stage, and we stayed with her less than 24 hours when we lost her because of pulmonary embolism. The other one who just came and pushed up on the second stage and just lost her in within 30 minutes. She was in labor, and the last one we just got just last week due to severe pneumonia. She had a collapse of one lung. So in those 1,300 with only 3 maternal deaths, for sure the team are doing a great job. I should thank my whole team, start from the hygiene, the cleaners. Without that, maybe we could be running up into sepsis and everything. The hygiene team, the nurses, midwives, the GP, the theater team. As once you see, we have operated all those mothers, but we have not ended up with any severe sepsis. So the sterilization team, I'm sure they are doing a great job, as we didn't have any reopening of severe sepsis and losing any mother through that. So personally, I'm great with the community, as I'm sure they're happy. I usually sometimes go outside and move around and chat with them. I've been receiving a lot of referrals once, yeah. You see, and then they say, there's a certain from Tanzania, you just go. So currently I'm actually receiving a lot of clients, not only from here, Kigutu catchment, some they're even coming now from Kigoma. And then you're just getting surprised. Why you have done all this? Oh, wait, why you didn't go? No, we have had this service and that. But sometimes even some of the services we cannot provide here. So we need to transfer them again to Bujumbura. So that way, I think personally also I've grown and I'm having a bit of attachment with the community. They appreciate my work of what I'm doing. So.
Indeed, indeed. So you talk about the patients you transfer from here to Bujumbura sometimes, but I also know that there are patients who are transferred from Bujumbura to here.
Yeah.
Can anyone tell us what is the story here? Why, what is it? Tell me, please. Anyone?
Yeah,
Cecilia?
I can start. So I've
What
received,
kind of patients are transferring to Bujumbura?
yeah, I've done electives from mothers from Bujumbura, some they're just gynecological cases. For the elective cesarean, most of them, they report that we have a good care. And one of the mother report that in her previous surgeries, she got complication on her wound. So she had to stay in the hospital for more than 2 months. So this time I think she had heard from someone else that you just go to Kigutu, you'll have a good recovery. And she came and I operated her, and I also received the feedback from her that she got cured and the wound cured it just within the 7 days. The gynecological cases, most of the time I'm receiving a lot of infertility. These are the couples who are coming looking for babies, yeah. But unfortunately also, I don't have much I can do with them. So I also still return them back for more investigation, as we cannot perform hysterosalpingogram, that is for looking for the pattern of the tubes. And some of the hormonal assays that we cannot do them here still. Yeah.
Okay. Any thought about? I know, Joelle, Dr. Joelle. I know the kind of emotional toll you had before having Cecilia, Dr. Nesar, and the many more who are here with us. I can imagine what kind of relief it has been for you. And I am wondering, Cecilia just talked about patients being transferred from Bujumbura to here and from here to Bujumbura. In your own department, the outpatient department, what are the most urgent needs? What are the challenges that you are dealing with on a daily basis? And what do you think that we can do to improve the situation?
Yes, with the opening of the new hospital, yes, we've been even having many patients, and also as the consultations are happening in the old clinic, and it's still the same.
Yeah.
So
maybe even more, because they know there is a hospital.
yes, we have many patients, but the clinic is still the same.
Right.
So the facilities have not changed at the clinic.
Right.
So first of all, maybe if we start from the consultations office, sometimes we struggle because they are not enough. So now we have to create space to have consultation. I would love to call a specialist and maybe be in his office, but now there's not enough space. I know it's in the plan of having this, but this also, I think, even if I'm not in this, but I know that would require funds to be able to do that. So that's also one of the challenge. Also have the challenge of because now we have a lot of influx of patients. Now they delay. There's the long delay. Sometimes can happen maybe at the lab because our laboratory is still the same. We need maybe Nesar can elaborate on that. The capacity of the laboratory needs to be increased because of the many patients we have. Yeah, so those are the first two things that we deal on a daily basis as a challenge. Because if we, as giving specialized care, you would need more investigation. And if the capacity is not increased, now the patients will delay, and we have many patients, not only from our catchment area, from outside our catchment area, as my colleagues also mentioning, we are having patients who are coming from Bujumbura, because also why are they coming from Bujumbura? Because we are providing
Tanzania, Congo as well.
Because there is they're in the community, they are receiving better care. Also, as a person, I also want to go where I know I'll be treated more kindly. Yeah, so I know even elsewhere, just maybe just the workload. It's like so many, but we try to do better. I think that's why they come more, even if it's far, and even transportation is they even pay more to come here because it's very far. So, but if they're still coming, even if it's far, it's just because they like what we are doing here. Yeah.
That's fantastic. Building on that, back to what you said, you have all these patients coming from different parts of the country beyond our catchment area, Tanzania, Congo, and it seems the flow of people back and forth from one hospital to another here and there. You are busy. It's a busy place.
Yes.
Many people couldn't believe that this would be as busy as it is, or not even close. It's in a rural area, it's in the middle of nowhere. I have, been challenged by a number of people, friends, saying that, and it's usually those who are not familiar with rural settings, especially in Africa. Their views are that a hospital like this one we have is not necessary. I, of course, couldn't disagree more. And here we are, so busy when for so long we're being told that building small clinics, mobile clinics, is what is appropriate for a rural setting like this one and all over the continent. We're having born and raised in a rural area and experienced looking at so many tragedies of mothers dying in childbirth because there's no access to C-section, for example, in many children who don't make it to their 5th birthday. In a country like this, where we have more than 80% of the population live in a rural area, it's hard to figure out what to say to such wonderful friends, but who are not really able to understand why we need a hospital like that. Given your work, Dr. Nesar, in a big city of Kabul, in such a big hospital, what can you share with us, please, the kind of disease you've seen here, the challenges you have seen here, it's not just malaria, it's not just HIV or TB, as many like to think that, Africa is a place for those kind of diseases and nothing else. Can you please share with us even a patient story that you may recall? If I know you see a lot of patients, to walk us through, this kind of different setting environment and how important it is to have this hospital. I know you said that, but I would like the audience, some of the people who are listening to us, to understand better why we actually not just need this hospital, we need 10 times more than what we do have here, given the demands, the needs, and the lack of access to quality healthcare. Please.
Thank you very much for this question. First of all, I totally disagree with those people that they think that the modern and well-equipped hospitals should not be built in rural areas and everywhere of the world, in Burundi, Afghanistan, Rwanda, in Tanzania. I totally disagree, because disease doesn't recognize border, level of income, or being in a city or in a rural area. When we see the burden of diseases in rural area, it is heavier in rural areas than the modern cities. I remember when I came here to Burundi, and I seen a lot of challenge cases here than in a very big hospital in my home country, in a big city. Very complicated cases, infectious, non-infectious diseases. And the patients were transferred from hospital to hospital, from health center to health center, with chronic conditions, with a very critically ill condition. If we believe in equity, health is a human right. It should not be only say that only the big cities deserve to have access to oxygen, to operation, to a good lab facility, or to imaging. The people who are living in rural areas and underserved communities, they deserve it. Every single human deserves this right, but mostly the people who are living in rural areas, they deserve these services. I remember when in the beginning of the opening the hospital, when we recruit specialists, and gradually the reputation of the hospital was growing in the region, we received a very critically ill patients, 38 female patient who was suffering for years from a very severe cough, shortness of breath, a very profound weakness, and he was diagnosed as a pneumonia case in many health facilities in Bujumbura and other regional hospitals. When we received these patients in our emergency medicine department, she was in a very critically ill condition. She was in cardiogenic related septic shock with severe sepsis and pulmonary embolism and unstable vital signs. As a doctor, Dr. Cecilia and Dr. Joelle are here, we know that the prognosis of these conditions are very poor. In a very modern, well-equipped hospital, always the mortality of these kinds of patients are very high. And our multidisciplinary team start working to stabilize the patient. They performed tests, including chest X-ray, echocardiography, and blood tests, and they start to stabilize patients. And day by day, the patient was improving. And after 9 days, the patient was discharged from the hospital in a very stable condition and very grateful. And it is not only a story. We have too many success stories. I remember we received a baby with 900 grams. 900 grams. In literature, these cases are very rare. Now this baby is coming for follow-up in this hospital, and he's growing, and he's alive. And we have many other success stories in surgery department and maternity and emergency medicine and internal medicine. I see that having a well-equipped and with multidisciplinary specialists are very important in rural areas than the cities. And this hospital is one of the most important example of this hospital. As after the opening of the hospital, the number of the patients are growing every day. Now, the number of outpatient and inpatients are doubled and sometimes tripled. And as Dr. Cecilia mentioned, the mortality rate is very, very low. Just a few days ago, I was reviewed the data from the hospital. We have an average 250 to 350 admissions in the hospital. It's very high admission rate. And the mortality rate is between 1.5 to 2%, which is equal to other modern health facilities in the world. And Dr. Cecilia mentioned they performed more than 1,000 normal delivery C-sections and other gynecological procedures, and they had 3 mortalities, which is, I think, below 0.5. And we have also challenges as we have a specialist in the ground, as Dr. Joelle mentioned. And still, our diagnostic capacity is limited. And yes, when we receive other patients in a critical ill situation and we do not have those services to provide those services for patients, we lose these patients. For example, patients with end-stage renal diseases who need hemodialysis, or patients with acute respiratory failure who needs mechanical ventilation and ICU that we don't have, or other diagnostic tests for the specialized care. But we are optimistic, and slowly, all services will expand. And I believe that in the near future, we will have a very well-equipped lab and also other imaging examinations and other diagnostic tests in this hospital.
Thank you so much. Last week, with the hundreds of community members, staff and friends, we celebrated here in Kigutu the life and legacy of our beloved Dr. Paul Farmer, who used to say that the idea that some lives matter less is the root of all that is wrong with the world. I'm glad that we have this hospital here. It is being used for exactly what it was built for. We are so happy to have friends, doctors who are skilled like you, not just skilled like you, but with the heart, the compassion that you have to care for the patients. But it's not just you being here where you are met by patients in the clinic. We have a cadre of community health workers who are in the communities, who are in different places near where patients live or whose family members are patients themselves. So they come, they help. Dr. Joelle, if I may get back to you, how has the community health workers model, the program, been helpful for your work, especially in the outpatient department? I know they do a lot of things, prenatal care, HIV, TB treatment and prevention and things like that. Could you please tell us more about how helpful this a group of community health workers that often doesn't get the acknowledgement and the reward they actually need? Could you please briefly share with us?
Thank you. Yes, community health workers don't really get the recognition they deserve, but they really do help so much because we do really need to emphasize that prevention is very needed if we don't want to have critical conditions, because there are conditions that can be prevented if we have people in the community sensitizing to know few things like clean your hands before you eat, because we have with having community health workers, there are many diseases we are not seeing because they are doing such a good job in the communities, because nowadays we don't see cholera cases, but they were, because village health folks have done a good job in putting water pumps in the community. They still needed to be educated on how to wash their hands, clean stuff, and the community health workers have done such a great job. So how we work with them is in their normal activities, they are supposed to be doing home visits to educate patients, and also once they see cases, they refer to us, whether it's about nutrition or whether it's about pregnant women who need to be seen. And also we educate them, like they come monthly here when they report the activities that they did in the communities. And also we train them because we need to build their capacities, because they also based on they are not healthcare worker, healthcare trained staff. It's just volunteers who want to improve the health of their communities that accept to be part of the community health workers. So we train them, and we have to keep recycling to build their capacities. So they refer patients to us, and we have seen there are many lives would have been lost if we didn't have community health workers. And as they also help us screen, for example, malnutrition, we do receive many cases when they're in their moderate stage, because they do regular screening in the community. So now we've seen that with the years, we have very few severe malnutrition, just because we have community health workers who are doing a good job in the community. As they constantly screen, now we have many moderate cases, so it's good that they don't reach the severe cases, because they are the ones that increase the death rate. They're the ones who are in the category that can just die easily in the community. So nowadays we don't see really those severe cases, even if we still get few, and even among those we get, half of them are coming outside of our catchment area, because our community health workers work within our catchment area. So they've been really a good help. They really need to be recognized.
Okay, great. Yeah, thank you so very much. We have 10 more minutes left. Maybe if we could go to our audience, and I have already 2 questions here for you. Maybe just starting with you again, Dr. Joelle. There's a question here. Discuss the best way to start with outpatient services and how to expand to inpatient, surgery, emergency, etc. Any of you not just Dr. Joelle, Nesar, discuss the best way to start with outpatient services and how to expand to inpatient surgery, emergency, etc. Anyone?
So our outpatient services, yes, we, as I already talked about the space and the lab, also needs as we work in health education, there are still things we still can't do, such as we don't vaccinating like mothers for like hepatitis B. It's not part of the national programs, but that's something that is needed as prevention. So there are many things we still need in the preventive side. If we, I don't know, maybe we can have someone who can help the whole country. It's in the whole country. It's not only village hospitals. And that becomes a big issue. Maybe them they can elaborate on that.
You know, what is really good I have seen here is that you try to prevent patients coming here from going straight to our new hospital. First, they start with the outpatient department, and then you do the evaluation, and then you decide who's going to go to the inpatient. Maybe Nesar very briefly, and Cecilia, if there's anything you needed to add to that.
Thank you for this question. You know that there is a very deep connection between hospital and OPD.
Yes.
As you mentioned, first patients came to the OPD after triage. They triage as red, yellow, and green. Green patients have been sent to the doctors and the consultation rooms, but red patients directly sent to emergency medicine department. And after consultations, doctors, when they see patients and realize that they need hospitalization, and they admit patients to the hospital. And when patients receive health care in the hospital, when doctors discharge those patients, and then for the follow-up, they tell patients to come to the OPD clinic back for the follow-up. For example, hypertensive patient, diabetic patients, or other chronic illnesses. And specialists and our general practitioner doctors are following those patients that has been discharged from the hospital, and they follow them in the OPD clinic. As OPD clinic is like a front line for our patients in this institution. And if we have a very effective operational and well-equipped OPD clinic, then all transfers to the hospital will be very effective, and the outcome of the patient care will be very high.
That's great. So maybe they covered everything here because we are getting more and more questions. Here's another question. What does the hospital landscape in Burundi look like outside of village health works? Maybe start with you, Burundian doctor. You, before coming to village health works, you worked in a number of hospitals, but even before that, you knew some hospitals, whether you were sick or you had friends you visited and so on and so forth. Very briefly, what is the answer?
So in Burundi, especially rural Burundi, there are few hospitals like village health works. You can even say now we are in the South region. That's the only hospital with a wide range of specialized care. That's why I even have many patients coming here, because in the South region, we are the only hospital offering many wide range of specialist care. So many rural areas have really very few specialist care. It's just maybe just few, like most is like surgery. some surgery and maternal and child health, like gynecology care, but I don't think we do have like a gynecologist in Burundi, maybe in Karusi. That's where I think maybe there is one, but
Yes.
in Burundi,
Yes.
not really. We don't really have specialists, except in Buja. Most of the specialists are maybe 99%.
Yes, I know the president of Burundi, when we opened 2 years ago, in his speech, he said that his goal was to build such a hospital we have here at Village Earthworks, 6 of them. And he said that now one is out of his way. He's going to try to replicate what we have here in 5 different regions. And if we could have that, life would be so much better. So these were his words. You were there. Most of you were there and heard about that. Just very quickly again, because we're running out of time, there's another question here. To what extent does Village Healthworks partner with educational institutions such as medical school to advocate for social medicine competencies? Dr. Nesar or Cecilia, maybe?
No, I think Messi can answer.
Okay. Yes, we have a partnership with the University of Burundi, and last year we conducted a social medicine training at the University of Burundi for professors, medical students, and other medical staff. And then we started to work to develop curriculum for family medicine residency program. That after that there was many meetings between Village Healthworks team and the University of Burundi, and now we are trying to implement the family medicine residency program in the country. And in the future, we will have another residency program on emergency medicine. That we, fortunately, we are the only hospital in Burundi that will have 2 emergency medicine specialists. Just Kibuye Hospital has 1 emergency medicine specialist, but we have here 2 emergency medicine specialists, and we have the capacity to start this training. And also we have another collaboration with the University of Washington in the US, and we have online courses for our staff, leadership, research, epidemiology, monitoring and evaluation courses for all our staff. And also we are trying to have more partnership and collaboration with other institutions, and our vision is to transform this institution as a center of excellence for the training in the region.
Thank you. Thank you so much. Dr. Cecilia, I have another question here. I listened to one of the doctors talk about how they are reducing maternal and child mortality rate. What was her strategy? What was your strategy, or what is it?
So the strategy which we have used to reduce the maternal mortality, first is the training. I managed to train my junior staff. Those are the GPs and the nurses and my team, that I make sure anyone who is there to manage a patient is able at least to provide a basic emergency response once the patients arrive. So training of the nurses, the midwife, and the GPs, especially on the emergency complications, such as antepartum hemorrhage, once the mother comes with a bleeding during pregnancy, that's as from 24 weeks. Management of the postpartum hemorrhage, that is after delivery, that it can be primary or secondary. So training on this, the junior doctors, that has really helped me to reduce the maternal mortality in my ward. So apart from that, having some essential supplies which are really needed for these mothers. for sure in my department, at least I can say I'm having at least everything which is needed to manage this mother, especially in management of postpartum hemorrhage, which is one of the most cause of maternal mortality. Preeclampsia, eclampsia, we have sure managed all the mothers who have come with this condition with good success, apart from losing of the babies due to prematurity. Yeah, that's what I can.
That's fantastic. So many questions coming, and we are running out of time, but let me maybe answer this question, Dr. Joelle. Is the OPD working only, or do patients make appointments? The answer is working. We are in a country where making appointments and that kind of stuff doesn't exist. The other question, how is this process managed given the patients are in various areas without phones?
They do not make appointments. That's why we have many patients in our OPD clinic.
And they are stressed out.
And we have to try and because they're coming from different parts and it's very far, they want to go back home, and we don't have where to put patients. That's where we have to work tirelessly so we can finish most of the patients before 5 p.m. so they can go home. And that's why there was an increase of general practitioners, because the Bukeneza explained the process. They have to come to the OPD. If we see that they need to go to the hospital, we have to link them to the hospital. Also, if they need specialized consultation, now we have to call in the specialist to come to consult the patient. So it's a walk-in, and it's very tiresome because we have many patients and we can't not tell them like go home.
Yes. Yeah, thank you so very much. I know how complicated with this scheduled and unscheduled care, and most of them are people who are coming, you don't expect them. Unfortunately, many of them come to Village Healthworks after having tried elsewhere in many different places, and when it's not working, they come here as the last resort, making your life more complicated than it should be. And this is why educating communities through community health workers and others is extremely important. So more questions, so many questions here, but we should close here. To everyone who have been able to join us, these hospitals and our patients department belong to all of us. You are part of this history. This is not just about saving lives. It's about removing barriers to human dignity with kindness, respect, and love. Thank you so very, very, very much for joining us and for everything you have done to help us. Thank you.
Mhm.